Hi, my name is Robert Bray, and this is the introductory video to the Tapping to Turn on Health series. We're going to spend some time reviewing the component parts of thought field therapy, going through them step by step so that you can take your time to become familiar with them, so that when you see them in other videos or see them in other thought field therapy trainings, you'll already be familiar with them. We'll also spend some time talking about some of the concepts that underlie the work we do so that you have a better understanding of what these terms mean and how they're being applied. Now, before we start, I want to remind you that to be able to learn efficiently and effectively, you need to not be overwhelmed by emotion or upset or pain. And I would encourage you to take a second and check out where you're at. If you're having trouble focusing because of those things, you might want to skip to the end of this video where I demonstrate doing thought field therapy algorithms. You can try those and see if that doesn't make things a little more comfortable and easy for you and make you a better learner before we continue. Now, I want to start where we always start in thought field therapy, is by focusing on what we mean by change. You're watching this video, you're reading my book, or you're struggling in some way to make change in your life, just like me, just like everybody else. And in order to know if we're making that change, we have to understand what it is. In thought field therapy, we are concerned about your reality. One of the first things Dr. Callahan taught me 17 years ago was that the importance of what we were doing was in the experience of our clients. Not what we thought should be happening, not what we hoped happened, not what has happened to other people in the past, but what is happening with the person that we're working with in that moment, in their reality. Now, how do we know what someone's reality is? Well, in thought field therapy, there's a number of ways that we recognize that and we look at it. The most important is to understand that reality, as we know it, is known through our body. So oftentimes when we're asking you to check in on what's going on with you, we're going to ask you to look at what you're experiencing in your body. What are the sensations, what are the perceptions that are happening for you, and how are you experiencing them? So, for example, when I say to you, what do you want to change? You could probably talk about some of the big things in your life that you want, some of the goals that you want to have happen, and all of those things. We try to focus that and be more specific and say, in this time, in this moment, what do you need to change to be able to do those things? And that would be focusing on what you're feeling in your body, what sensations you're having that interfere with your being able to study, to learn, to grow, to do things differently. So when we start to looking at what's going on in reality, we can identify it in several ways. Now, the most important in thought field therapy for our work is the subjective units of distress. And that's an expression of your internal sensation, your internal awareness. Now, we don't have to just rely on our internal awareness. We can also look at other things like our behaviors. We can also look at our body's biometric measurements. We can look at how fast your heart beats. We can look at your respiration rate. We can look at are you sweaty? We can look at the expression on your face. We can look at what you're doing. We can also observe the behaviors. Where are you going? Where are you staying? Who are you engaging with? Who are you not engaging with? All of these things are clues about what's going on in your reality and what you're experiencing at the moment. So with thought field therapy, we have lots of ways to look at these things. The most important, as I said, is the subjective units of distress. So this is an approach to reporting what's going on with yourself. It's a self-report. It's a simple thing to do. It's on a scale of 1 to 10, 1 being no distress, 10 being the worst you can imagine. How bad do you rate the problem at this point? So now it's fairly straightforward. We ask people to tune to a thought, and we'll come back to that in a second. And once they do, then we ask them to notice what the sensations are in their bodies. what the experience is that they're having in their body. Some people are going to notice a tightness. Some people are going to notice an emptiness. Some people will notice a burning sensation. Some people will notice pain. Whatever you notice in your body, that's the reality that you're experiencing right now. And that's the one that we want to help you change. So we'll ask you to rate that on a scale of 1 to 10 so that we can communicate accurately what is going on with you. Now, some people think that we're asking them to come up with a number in their head, but we're really not. We're asking them to use their body as an instrument. So to go inside and to notice the pounding, how bad is it? To notice the tension, how bad is it? To notice the twisty feeling, how bad is it? Now, some people say that they can't get a feeling in their body. They're not aware of sensation. They're not aware of what's going on. And they can't even get down below here with what's going on. Well, that's not terribly uncommon because sometimes people numb to deal with these feelings because sometimes the feelings are so bad or overwhelming that we've learned just to shut them off. So one of the things you can do is if you have trouble getting in touch with what you're feeling, the question would be is how numb do you feel? And if you can be aware of how difficult it is for you to have sensation in your body, you can rate that 1 to 10. 1 being that you have no numbness at all, and 10 being you're totally numb from the neck down. Now, it's important that while we can use other observations, and in advanced techniques in thought field therapy, we can use kinesiology muscle testing, or some people call it energy checking, to know what's going on and to be able to get the information we need. When we're doing algorithms or standard treatment solutions, we need you to be in touch with what your SUD level is because that directs what we do next. In thought field therapy, everything we do is response driven. That is, the response of the body, the mind, and the spirit tells us what we do next. In causal diagnosis, the techniques Dr. Callahan originally developed, we use that muscle testing to determine what's going on and to direct us as to what we need to do next, whether that's correction for reversal, a tapping pattern that needs to be done, the 9 gamut series, or other techniques. We can know by what the body's telling us, either through muscle testing or through the SUD levels, what we do next. So once we have decided that we want to try to make a change, let's be as specific as we can be about the type of change that we want to make. So one of the things that we do right in the beginning when we start treatment is we ask people to tune to the thought. So that could be we ask you to recall a memory. That could be we ask you to imagine something in the future. That could be we ask you to confront something right now. When you do that, then that information that you need about that is instantly available. And in most cases, you're going to have a body response to it. And that's what we use to set our SUD levels with. Now, if you don't have a body response to it, again, you might be able to use the numbing concept as a way to get a SUD level. If you don't, you can do more advanced techniques. And we can also use biometric measurements such as heart rate variability to help us indicate changes. Heart rate variability is a technique that we've used a lot in thought field therapy as a way to measure what's going on. It's a placebo-free cardiac tool that can be very effective in telling us what overall health is and what change is occurring. But let's not complicate it, because in thought field therapy we always start with the simple and move to the most complex. So let's start with the simple. Think about the problem. And that means simply recall it, imagine it. Some people come up with pictures in their mind when they think about something. Now, if you don't have a picture in your mind, either still or moving, don't worry about it. About 80% of people are visual and about 20% aren't. But they can still hold an image, they can still be aware of a memory, they can still think in a way that has to do with words or feelings or actions. And however you operate, it doesn't matter. So when somebody says, think of the problem, just do it the way you do it, when they ask you to picture it, just imagine it however you do it. So once we tune the thought and we can be as specific as possible, then we want to get the sud level. Once we have that on a 1 to 10 scale, then we can begin to do some tapping. Now, when we tap, we're doing this in a pattern. That pattern is dependent on what you need at that particular moment. In causal diagnosis, we can be very precise about that. In algorithms, we're using standard patterns that have worked thousands of times before, and there's a high percentage that it will work for you for that particular problem. So when you pick the pattern that you're going to do, you're going to do it in 3 parts. The architecture of thought field therapy is that a whole treatment sequence, something we call a whole line, has 3 parts. You tap on the meridian treatment points, the majors, then you tap on the 9 gamut series, and then you repeat those majors. So I'll go through each one of those as we go along. Now, first, let's talk about where the treatment points are. So you have tuned your thought, you're focused on what sensation, what experience you're having, what the reality of that is for you at that moment. You've set a sud level, and then you're going to tap. So let's go through where the tapping points are. So I'm just going to go through all of them so that you can see them and think about where they're at. Now, the first is right here at the beginning of the eyebrow. So this is between the center line of the face and the beginning of either eyebrow, and you can tap on one side or the other side. You can tap with one finger or several fingers, it doesn't matter. All you want to do is make sure that those points get stimulated in some way. Then, so that's the beginning of the eyebrow, that's the eyebrow point. Then the next one would be the outside of eye, which is right on the corner of the eye there on the bone towards the temple. Now the next point is under eye, and that point is right on that orbital bone underneath the eye, directly under the pupil as you're looking straight forward. Now the next point is under the nose, and that's right on the upper lip, right in the middle. Then the next point is on the chin, and that's below the bottom lip, right in the middle of the chin. Next point is collarbone point. Now the collarbone point is the easiest way to find it is go to this notch in your throat here where you feel your 2 collarbones coming together. Go straight down from that notch about 1 inch, and then go over to either side about 1 inch. Again, remember these points run on both sides of the body. So now you're right underneath the collarbone. That's another way to find it. Go on the collarbone, slide the collarbone down to the sternum. That's the breastbone. And right there where the rib and the first rib and the collarbone and the sternum come together, tap there. Now remember, you can tap on both sides. You can tap on either side with either hand. It doesn't matter. In the beginning, Dr. Callahan tapped on both meridian points at the same time, and what he found is that that's not required. So we found through tens of thousands of testings that it works just as well to tap on one side, and you can switch sides with your hand, you can switch hands, and that's fine. So now we've got the beginning of the eyebrow, right? We've got the outside of the eye, and then under the eye. Then, yeah, under the nose, then on the chin, and then the collarbone point. Then the next point is under the arm in the middle of the rib cage, and you come down about 4 inches from your armpit. With women, we say where your bra comes across your ribs. With men, we just say on a line level with your nipples, and you can tap there. Again, it doesn't matter how you tap. You can tap like this if you want, if that's more comfortable for you. Now, the next points are the ones on the hands. So when you look at your hand, you're going to look at the back of your hand, and let's start with the little finger. So you go to between the last knuckle and the bed of the nail, slightly towards the thumb side, and you tap there. Now, the next one is the middle finger, is the same thing, between the last knuckle and the bed of the nail, slightly towards the thumb. Index finger, and then thumb. Now thumb, you want to be on the outside. So notice, you've been tapping towards the thumb, towards the thumb, towards the thumb, outside of the thumb. All right? Now, also on your hand are two other very important points. The first is the side of the hand. So it's the same point that you would use if you were going to land a karate chop. It'd be where you'd make contact. Now, the last point is the gamut spot, which is between the two small knuckles and go down about a ½ inch. So those are the points that we most normally use. Now there is another point that you may run across, and that's called the liver point. And the way you find that is you go, on men we say just go straight down from the nipple to the bottom rib and then come up to the first space between the ribs. And that's what we call the intercostal space there. And you don't see it very often in algorithms. As a matter of fact, it's not included in algorithms, as are a couple of the other points, but sometimes if you're doing causal diagnosis, the most advanced treatment, you will see it. So let me go through this once more. I know that this is a little repetitive, but I want you to be really comfortable in easily finding the points, so just do that with me. So the points are the beginning of the eyebrow, outside of eye, under the nose, on the chin, under the collarbone, little finger, middle finger, index finger, thumb, okay, side of the hand, and then back of the hand. And that point that you rarely will see unless you're doing causal diagnosis is the rib or liver point. Okay. So those are the points that we tap, and we tap in an order that provides information that provides the healing. So the order does matter in thought field therapy. And the way that you'll pick your order is through algorithms, which are standard treatment sequences, which are related to specific emotions or conditions. We have 14 of them. They're in my book. They're in Dr. Callahan's book. They're also what you learn in algorithm training and also in the thought field therapies boot camp training. Now, after you do the tapping, once you find the order that you're going to tap on, you tap that point, and then you need to do 3 parts to do a complete treatment sequence, whole on. And this is going to be true in any type of thought field therapy that you do. The first will be to tap the major treatment points in the order given, then to do the 9 gamut series, and then to repeat those points again. So when you see the video at the end of me doing treatment, you'll see that pattern. In the other videos that you watch, training videos, you'll see that pattern over and over again. So always remember, after you do the 9 gamut series, repeat the points that you did before the 9 gamut series, and then you stop. That's a complete treatment whole on. And then you're going to ask yourself, has anything changed? And you go back and you look at whatever you were measuring with a sub before, or whatever way that you were measuring it, and see if it's changed. Now, generally, if it has, then you're on the right track. If it's gone to a 1, then you're done. If not, then there'll be another technique to use. If it's not finished all the way down, then you may need to do psychological reversal. So before I talk about that, though, I do want to talk about the 9 gamut series, because this is an incredibly important part, and it's included in every treatment sequence that we do. Complete treatment sequence that we do. So we call the 9 gamut series because this is the gamut spot, right? Halfway down between these 2 small knuckles, or I'm sorry, ½ inch down from there. You're going to tap those things while you do 9 things. Now, originally, Dr. Callahan found that he could test for each one of those individual things, and in causal diagnosis, you can do that. But after a lot of experimentation, he found that it was a lot easier just to have people go through the process each time rather than testing for it every time. And it's very difficult to test when you're doing algorithms. So the way it's done is there's 9 things you do. You close your eyes, that's 1. You open your eyes, 2. You're going to look down left, 3. Look down right, 3. Now notice in each one of these things I'm getting at least 5 taps. Now, you're going to rotate your eyes in a circle all the way around the room in one direction and then the other way. So now the easiest way to do this is drop your eyes to the floor and then look down into the right corner of the room and then look up into the right corner of the room. Now look straight up. Now look off into the left corner of the room. Now look down to the lower corner of the room and then look your eyes, look right at the floor again. Now it's the same thing, go back the other way. Look at the bottom, look straight down, look over to the lower left corner, look over to the upper left corner, look straight up, look over to the upper right corner, down to the lower right corner, and down to the floor again. Now after you've done this a couple of times, it'll be second nature to you, but you may have to practice a little bit because you got to keep your fingers going at the same time you're rolling your eyes around. Now, so that's, remember the first thing was close your eyes, 1, open your eyes, 2, look down left, 3, look down right, 4, roll your eyes in one direction, 5, roll your eyes in another direction, 6. Now 7 is hum a couple of bars of any tune. And it really doesn't matter what you hum. The idea is we want you to close your lips so you're not using words and to make sure you get more than one note. And that's because we're moving into the musical part of your brain, which is on the right side. And we then count 1, 2, 3, 4, 5. And that moves the thought into the left side of the brain. And then we have to hum again. Now, those are the 9 things, right? Again, close your eyes, 1, open your eyes, 2, look down left, 3, look down right, 4, roll your eyes one way, 5, roll them the other way, 6, hum, 7, count, 1, 2, 3, that's 8, hum again, that's 9. Now, you're tapping all the way through that. Now, people ask, well, why are we doing this? And the idea here is that we're moving the focus of the thought to different parts of our brain. That's just the theory. We don't know exactly what happens, but through testing, we know that it greatly improves the power of thought field therapy. Also, I want you to be aware that it doesn't matter which side you look down to first, left or right. It doesn't matter which way you roll your eyes, around in one direction or clockwise the first time or counterclockwise the first time. Doesn't matter as long as you get through all of it. And remember that on those last 3, you hum, count, hum, because we found that if you correct a problem on one side, you have to go back and correct it on the other side. So that's the pattern that you're going to do consistently in thought field therapy. So you need to learn it and be comfortable with it. You'll find that after you do it 3 or 4 times, it'll be second nature to you. So remember that again, after you do the 9 gamut series, you're going to repeat the tapping you did before. So you start with tapping, right? The pattern that you're given in algorithms or the pattern you're given by the body in causal diagnosis through muscle testing. Then you do the 9 gamut series, and then you're going to repeat the pattern that you did before. It's the same pattern, and when you get done at the end of that pattern, when you get, then you're done. That's a complete treatment sequence, a whole one. Now, when you finish that, you're going to stop and you're going to say, okay, so what's changed? Now, again, back to the sublevel. Now, we expect that if we're doing effective treatment, that the sublevel will come down very quickly. Now, if it doesn't come down, if it doesn't move at all, if it doesn't change, then that probably indicates psychological reversal. If it comes down, from say a 7 to about a 4, that also indicates that there's a problem called psychological reversal. We correct for that psychological reversal and then repeat the treatment. Now, psychological reversal is going to come up a lot. You're going to see it, if you do a lot of this work, you're going to see it about 20% of the time. Some people have very little psychological reversal. Some people have a lot of psychological reversal, and there's reasons for that. But it's not something that needs to stop us, because Dr. Callahan, one of his first discoveries, was a way to correct for this easily and simply. And the easiest and simplest way to do it is by tapping on the side of the hand. Okay. So that's the same point you saw before. That's the karate chop point, and you tap there when correcting for psychological reversal about 10 to 20 times. When you're tapping on meridian treatment points, the other points, we tell you to tap 5 to 10 times, half a dozen to a dozen times. Now, so correcting for the reversal is done in 3 ways. This is the first one. The second one is rubbing the sore spot. Now, we don't always use this one, but in the protocol, you'll see there's a place for it. And what the sore spot is if you push around on your chest, you're going to find a tender spot. That tender spot is a lymphatic drainage point. And one side may be more tender than the other, but you just rub it for about 10 seconds. And then you go back and do the treatment again. So now the third place that we correct for psychological reversal is under the nose. So again, there's 3 ways that you're going to be correcting for psychological reversal until you get into more advanced treatments. But for right now, it's the side of the hand, rubbing the sore spot, or tapping under the nose. And the protocols that you use in algorithms or that are given to you in the diagnostic causal procedures will tell you which one you do when. But it's very common, and don't be surprised if the first time you do a tapping pattern, if it doesn't change, it just means that probably you have a psychological reversal. Now, think about psychological reversal simply as there's a problem with the direction of the energy that's flowing. So think about it in a clock. So if you have a battery in a clock, battery has polarity. The energy has to flow the right direction. The electrons have to flow the right direction in order for the clock to work. If you take the battery out, turn it around, put it in with the polarity reversed, it doesn't work. And that's because the flow is not right. If you take that out, correct that reversal, correct the polarity, put it back in the way it should, the electrons flow the way they should, and the clock works. So that's basically what happens to us. Now, why do we go into states of reversals? We have lots of theories about that, but it generally is something that you don't have control over. You can't think I'm going to reverse or be not reversed. It's something that just happens when you tune to a thought field. And there may be reasons that people have a lot of reversals, and we talk about that in more advanced training when we talk about individual energy toxins, which may be causing the problem. So when we're doing thought field therapy, we're going to tune to the thought. We're going to then identify a sublevel, some way in reality we know of what's going on that we can judge if change is happening. Then we're going to tap an algorithm or a treatment sequence given in causal diagnosis, a pattern, and that pattern is always 3 parts. Tapping on the major treatment points, then doing the 9 gamut series, then tapping on those major points again. Then we're going to stop and look at the sublevel again and see if things have changed. If things have not changed, then we know that there is possibilities of a psychological reversal. Now, we'll correct for that psychological reversal by tapping on those points 10 to 20 times, and then we'll repeat the treatment again. If that doesn't work, then we know that it's a more complicated problem that we've got, and the next step that we generally take is to tap on our index finger. Tapping on our index finger is considered a quick treatment for individual energy toxins. Individual energy toxins simply mean that there's something in the environment or that you've been exposed to that causes your body to go into a reversal or causes it not to be able to correct in its own natural healing way. Now, individual energy toxins come in 3 forms. It could be something that you've inhaled, and that includes things that you smell, somebody's perfume, cleaning product. It could come in the form of ingested toxins, something that you've eaten or drank, or it could come in the form of contact toxin, something that you're wearing or a cream that you put on your skin. All three of those things can create a problem for your body, and if that happens, we need to find that and to correct it. In the most basic work that we do in thought field therapy, we tap on the index finger 15 times, then we'll correct for the reversal, and then we'll return to the treatment sequence that we did. So after you do that, then you want to do a complete treatment, which includes the 9 gamut series, repeat the points that we tapped before, and then take the SUD level again. Now that SUD level is what tells us what to do next, because everything we do is response driven. Now, hopefully by this point you will have been resolved whatever problem you started with. You made the change in your ability to think about, recall, to operate, to behave, and to feel okay in your body doing it. Feel at comfort, feel at ease, and feel that tension gone to 1, feel that burning sensation gone to a 1. Now, if for some reason that doesn't work, then you have to go on to the next step. And the next step is what we call collarbone breathing. And collarbone breathing is a correction for something called neurological disorganization. What that simply means is that your body is out of sync, that your body's rhythms have somehow come out of sync to such an extent that it's not able to heal itself, it's not able to respond to the healing mechanisms that you're using. And collarbone breathing is the most complicated thing that we do. It only takes a couple minutes, but most people go, oh, I don't want to do it. Don't worry about it. It's really easy. And after you do it several times, you'll find that it's second nature. You can do it without even really thinking about it. So as soon as we finish this video, this segment, I'm going to take you through collarbone breathing step by step so that you understand how it's done. And then after that, I'm going to take you through a couple of algorithms with the corrections for psychological reversal built into them so that you can see what that looks like. So one of the other components of thought field therapy that you may sometimes run into is something called the 7-second treatment. Now, I'm going to show that to you right now because in advanced treatment, when you're working with somebody who's been trained in causal diagnosis and working with this, you may be asked to do this. And so I just want you to see what it looks like. So the way that it works is you'll be told to treat on inhale or treat on exhale. And the treatment is very simple. The treatment is simply holding your skull as you breathe out or holding your skull as you breathe in. And then you release on the alternative. So what that simply means is if you were instructed to do treat on breath out, what this would look like is you put one hand on the back of your head, right here on the bump, right? And then one hand on your forehead. And then you're just gently going to hold your head as you breathe out. So release the hold and breathe in. Now hold and breathe out. Release, breathe in. Hold and breathe out. Release and breathe in. Hold and breathe out. That's what it looks like. Now, you're just gently holding here. You're not using a lot of pressure. It's just a very few nickels in your hand is about the amount of pressure you want to use. What you're doing is allowing the bones in your skull to kind of adjust as you're breathing in or as you breathe out. And it happens naturally and it's easily, and it's a very powerful technique, and you may need to do it at some point. I just wanted you to be aware of it. So let's go through this again, just so you're clear. We always start by looking at the reality we want to change. That's tuning to the thought. And sometimes it's difficult to get people to be able to tune to it. And so we ask them to sometimes put themselves in perceptual field. So with a child or an infant, you can't just say, think about it. We have to show them something so that they can be aware of what it is that we're going to treat. So that would be like a child who's maybe afraid of water. So you would show the child the water. It might be somebody, for example, sometimes it happens that people have difficulty tuning to a thought field around something like their fear of heights. But if you present them with the fear of heights, then they will be able to feel the feelings. Now, remember, in thought field therapy, we're not about pain. We're not about suffering. We're about ending pain. We're about ending suffering. And so we don't want to do things that create uncomfortable positions for people. So if you are going to be putting yourself or someone else in a perceptual field, approach it gently. Approach it slowly. And as soon as you feel a feeling that you know that you want to change, stop and tap. You don't have to be at a 10 to make the change effective. And if you find yourself needing to really test something, if you've treated it, if you can think of your fear of heights and treat your fear of heights, and then in the moment it goes away, and then you want to test it in reality, again, treat yourself gently, approach things slowly. As soon as you feel any discomfort, if it should come back, sometimes it doesn't, often it doesn't, then stop and treat yourself before you push yourself to do things that are uncomfortable. So after you've identified what you want to treat, tuned the thought, you've been able to come in touch with the reality that you want to change and rate it on a 1 to 10 scale in terms of sensation in your body or perception or even numbness, then you treat by tapping on the meridian treatment points in the order that's given to you, tapping on the majors, and then there's 3 parts to a treatment sequence. Tapping on the majors, doing the 9 gamut series, and then repeating the majors back to the 9 gamut series again. Now, after that, you take your sud level again. You may or may not have to do another tapping sequence. You may or may not have to do the corrections for reversals. But if you do, if you're making some headway, then you do the corrections for reversals and repeat it. Now, if that's not working, if the correction for reversal is not working, then you're going to correct for for individual energy toxins by tapping on the index finger 15 times, then doing correction for reversal, then repeating the tapping sequence and the 9 gamut series and the sequence again. Now, if that doesn't work, then you're going to do collarbone breathing. And I'm going to take you through collarbone breathing now so that you can get comfortable with it. Now, what's going to happen is that, remember we talked about polarity in the body? Well, there's a polarity on one side of your hand versus the other side of the hand. So we want to use both of those polarities in the treatment that we're doing. We want to work on both sides of the body because we're trying to reset the body. It's to reset the rhythms and the sequences of the body so that things work in their natural way again. So, and the way we do that is through the use of the breath. Now, this is enhanced by also tapping on the meridian, on the gamut spot, that meridian gamut spot. So, while it may appear a little complicated as I talk about it, just follow me through now, and then you'll see how simple it is. And after you've done it a couple of times, it'll be second nature to you. So, we're going to start though by touching with your finger pads. Start with the right hand touching the right collarbone point. Keep your thumb up and out of the way. And then you tap the gamut spot. So that adds power to it. And then you're going to do the breathing with pauses in the breathing. So the breathing goes like this. You take a full breath. And you're going to hold the breath for at least 5 taps. Now breathe out halfway. And you're going to hold it halfway out for 5 taps. And then breathe out all the way. Holding again for 5 taps. Now breathe in halfway. And then you're going to breathe normally. And while you're breathing normally, you're going to change your hand position. You're going to go from finger pads to finger knuckles, back of the hand. Now you can do this in any order, but this is the way I do it. So tapping again on the meridian point for the gamut spot. Take a full breath. Halfway out and hold each one of these. All the way out, hold. Halfway in, hold. Now, take your knuckles across your chest to the other collarbone point. And now you're going to keep tapping, full breath, halfway out, all the way out, halfway in, breathe normally. Fingertips, full breath, halfway out, hold, all the way out. Remember to hold in each breathing position. Halfway in, now breathe normally. Now what you're going to do is switch hands. So you're going to take your left hand, touch your left collarbone point with your finger pads, tapping the gamut spots. You're going to take a full breath. Now, breathe out halfway and hold. Breathe out all the way. Breathe in halfway. Breathe normally. Now with the knuckles, full breath. Halfway out. All the way out. Halfway in. Breathe normally. Knuckles to the other side. Full breath. Halfway out. All the way out. Halfway in. Breathe normally. Finger pads. Touching the collarbone point. At some point you tap when you're doing collarbone breathing. Tapping the gamut spot. One in the back of your hand. Take a full breath. Hold. Halfway out. All the way out. Now halfway in. Breathe normally. Now, that's collarbone breathing. Now, you can touch in any order you want. You'll see some descriptions that are finger pads, knuckles, knuckles, finger pads, knuckles, knuckles. So, but the order doesn't matter as long as you get all of those. So again, there's 8 different points. Finger pads, knuckles, knuckles, finger pads, other side of the body. This side of the body, finger pads, knuckles, other side of the body, knuckles, finger pads. Tapping the gamut spot through the whole thing. Now, you won't need collarbone breathing every time you do treatment, but if you need it, then it will make the big difference, and it will make it possible for you to get a treatment effect when you haven't before. So again, remember the sequence of things are that you tune to the thought, focus on the reality that you want to deal with, whether that's a memory, something you're recalling from the past, something that's going on right in this moment, something about the future. It could also just be a sensation in your body you can tune to, and that oftentimes with pain, it's not that complicated. We just say, feel the pain and rate the pain. So for some people, it's easy to find that. Other people, it's more difficult. But with a little practice, you can come more in touch with your body. And that will lead you in understanding whether or not the thought field therapy is working. And once you know that, then you can move forward to the next technique that is driven by the information that we have, by the responses we're getting. So after, okay, I'm going to do this again. So tune to the thought, the reality you want to deal with, become aware of the experience of it in your body, rate that on a 1 to 10 scale. We use 1 being none. Now some people may think 0 is 1. You can do that if you want. That means 0 to 10, that's an 11-point scale. But be clear about what none means. When you're at, there's no more upset, there's no more discomfort, there's no more pain. So then you set that, and you get to set that. It's like it's an instrument, and you get to calibrate it and set it at any way that works for you. Just remember to go back to where you calibrated before and notice the change from there. After you do that, then you're going to tap a pattern, and that pattern could be an algorithm, a pattern that's just given to you, or it could be a causal diagnosis pattern that is specific to your position, your time, your place, your thought field which you're working with. That's the beauty of causal diagnosis, is it's more specific because it's developed directly through information the body gives to the practitioner at that moment, and it's very precise and specific. So, but whatever that pattern is, you're going to tap on those meridian treatment points, the same points they use in acupuncture and acupressure, and you're going to tap on them, and then after you do that, you do the 9 gamut series. And I'm going to go through that once more. You'll see me do that when I do the examples of the algorithms. And then you repeat the major points you tapped before, and then you go back and you check and you see if there's been a change. And if there's not been a change, or there's not been a complete change or elimination of the problem, then you're going to correct for reversal in one of those 3 ways I showed you. And then you're going to repeat the tapping again. And you're going to do the 3 parts again. Majors, 9 gamut majors. And then you will take your sub-level again. If there's still no change, or there's not complete elimination of the problem, then you will do tapping on the index finger 15 times. This is the standard stuff we do in algorithms. If you're doing causal diagnosis, we will go in a more precise way to understanding what the problem is and correcting it. But this is what we do in a general way with algorithms. So after you tap there 15 times, then you correct for reversal. Then you go through the 3 parts again, majors, 9 gamut majors, and then take the sub-level again. If you have gotten some success with that, you will repeat all of that until you get to a 1, until it's completely gone, or until it doesn't change anymore. If it's not changing anymore, or hasn't changed, then you need to do collarbone breathing. And that was the process that I just showed you before with the 8 different touching positions, right? Tapping on the meridian treatment point all the time. You do 5 breathing. Full breath, halfway out, all the way out, halfway in. Breathing. Now, if you get through those parts of it and it's still not working for you, you need to reach out to somebody who has more experience or more knowledge, because we have more advanced techniques that will be helpful to you, but you need to find someone who's done them or can help you with them. You can also take online courses to learn them for yourself. You can also go to the Callahan Techniques Thought Field Therapy directory and find a practitioner who can help you with this. Now, those are the component parts of thought field therapy, and a little bit of how we think about what we're doing. Again, we are concerned about your reality, your experience in the moment, and how things change for you or don't change. That's all that really matters. Don't worry about whether or not somebody says you should change, you should feel different, this should work. The only thing that matters is, what is your reality? And the best way we communicate that is with a sub-level, subjective units of distress. Now, if for some reason things aren't changing, don't give up. There's lots more that you can do beyond what you're going to hear in the basic instruction videos that you get. And we have had great success in the past with all kinds of problems. Now, I'm going to go through a couple of the algorithms now that I think, I'm sorry, I'm looking at my notes to make sure that there's nothing that I wanted to cover I haven't covered. And it looks like we're ready to review 2 basic patterns that I think are often helpful. So the first will be traumatic stress with anger and guilt. So this is the longest tapping pattern we use in algorithms, and I've added to it because this is the pattern that I fall back to when I'm working with people and I don't have time to do anything other than just teach them something real fast. So I include the correction for reversal. Remember this, where we talk about tapping the side of the hand or rubbing the sore spot or tapping on the nose? The reason that I include it is because it's safe. it's not going to cause any harm. It doesn't cause reversal in the flow of energy. Psychological reversal only can be corrected by tapping in this way. It can't be caused. So it's safe to do that, and when I'm working in a hurry with people, I will sometimes just do that. And again, this is a pattern that I hope helps people very quickly. So when I'm working in crisis situations, I often use this. So here's the pattern for doing the algorithm for traumatic stress with anger and guilt, with corrections for reversal built in. So if you're doing this for real right now, think of the event, and this would be good not only for something in the past, but it's also helpful for events that are happening right now. It's also helpful for fears and phobias about the future, and you can try this one to help you with that right now. So think about what you want to change. Notice what you're feeling in your body, and sometimes that's easy to know because the sensation that's going on in your body is immediately apparent to you, or the fact that you're caught in certain thoughts and you can't get out of them. It's immediately apparent to you, and that creates just this uncomfortable feeling. So whatever it is, whether it's how fast the thoughts are spinning through your head or how tight your gut feels, you rate that on the 1 to 10 scale. Now, after you do that, then you're going to start tapping, and you don't have to keep taking your mind back to it. You will be locked into the thought. So we start by correcting for reversal, tapping on the side of the hand, tapping under the nose, again 10 to 15 times when you do these, and then we're going to tap the pattern for traumatic stress, and you tap 5 to 10 times at each point, beginning of the eyebrow, under the eye, under the arm, under the collarbone, index finger, under the collarbone, little finger, under the collarbone. Then we do the 9 gamut series, tapping the gamut spot. Close your eyes, open your eyes, look down left, look down right, roll your eyes around in one direction, roll your eyes around in the other direction, hum, count, 1, 2, 3, 4, 5, hum again, and then we're going to repeat the tapping we just did. Tap the side of your hand, tap under your nose, tap the beginning of the eyebrow, tap under the eye, tap under the arm, tap under the collarbone, tap on the index finger, tap under the collarbone, tap on the tiny finger, tap under the collarbone. Now, stop, and then you go back to the thought field that you were tuned to before, whatever image that was, whatever sensation that was, and you notice it again and rate it again on that 1 to 10 scale. If it has gone down, but not all the way gone away, you can just repeat what you did again, and hopefully that will take it further. If it's not going down or stopped going down, then you can try tapping on the index finger and doing it again. Or if that doesn't work, you can try doing collarbone breathing exercise and then do it again and see if that helps. It probably will. If it's not helping, don't give up. Just know that you need to reach out to get a little bit more advanced technique. You need to use some more sophisticated ways of detecting what the tapping pattern will be for you. Now, the other pattern that I want to show you, because we often use that with people, is the pattern for pain, physical pain, and also for depression. Now, it's the same pattern for physical pain and depression, and it's pretty straightforward in terms of identifying the sublevel. So if you're treating pain, just notice the pain wherever it is and rate it on a scale of 1 to 10. 1 being none, 10 being the worst that you can imagine or remember. And if you're treating depression, just go to that depressed feeling. If most people who are depressed over time have a pretty familiar relationship with that feeling of depression and won't have trouble identifying it in their body. Rate it on a scale of 1 to 10, and then you tap in a different pattern Now we're going to do this with corrections for reversal built in, so we start by tapping on the side of the hand, tapping under the nose. And then the treatment is gamut 50. And you can count 50 times, or you can just tap for about 20 seconds. And then the next point is under the collarbone. And again, here we just do a half dozen to a dozen times. We don't have to do more than that. We always just do a half dozen to a dozen times unless specified for more. Then, after we've tapped these major points, we have to do the next part, which is the 9 gamut series, tapping the gamut spot. Close your eyes, open your eyes, look down left, look down right, roll your eyes around, back the other way, hum, count, 1, 2, 3, hum again. Good. Now, we're going to repeat the major points before that, just like we're doing in every treatment sequence. So we're tapping the gamut spot again for 50 times, or about 20 seconds. Some people tap faster than others. And it doesn't really matter how fast you tap or how slow you tap. You find the rhythm that's right for you. Now, after you've tapped the gamut spot 50 times, then again you tap under the collarbone. Now go back to the pain or the sense of depression and rate it again 1 to 10. 1, it's gone and you're done. If it's dropped some but hasn't all the way gone down, or it hasn't dropped completely, then you need to follow that sequence we did before, which is correcting for reversal and tapping again the entire treatment sequence, including the 9 gamut series. And if that doesn't work, then correct for correct for individual energy toxins by tapping here. And then repeat the correction for reversal, repeat the tapping pattern, the 9 gamut series, and the tapping pattern. If that hasn't taken you to a 1 or you haven't moved, then you do collarbone breathing, repeat the tapping for the index finger, then correction for reversal, and the tapping pattern. Now, hopefully by then, you'll be feeling no pain. If you still are struggling with it, then again, you need to reach out for more help. There's lots more techniques. It's just that you need to use more sophisticated techniques to determine the tapping pattern and what needs to be done. So I hope this has been useful to you, and I hope that as you go through looking at the other series, it'll be easy for you to recognize what we're doing and how we do that. I hope that you will hang in there with us and keep doing this. I'm trying to think of the other things that I want to say and before I end. And I think that I want to say to you, thank you for taking the time to review this. It's going to be helpful to you. It's going to make it easier for me to take you on to the next steps in terms of learning how to be more specific and to focus on healing in particular areas of your life. Feel free to give me a call if you need help, or to send me an email. I'd be more than willing to answer a quick question for you. And always remember that you're not alone. And whatever you're struggling with, you're not the only one who's dealt with it, and you're not the only one dealing with it at this moment. You're not alone, and there's lots of things to be done to be better. So thank you, and I hope to see you again soon. Bye-bye.